Hi, my name is John Bosworth. I'm a licensed mental health counselor in St. Petersburg, Florida. I'd like to speak about the long-term effects of methadone addiction in children. First of all, addiction to any substance at any age or for any age for a person can create problems, and I like to look at it in three different areas. And the first problem we want to look at is medical or biological. Biologically speaking, when an addiction becomes dependency, the body, of course, is dependent, that's where the word comes from, is dependent on the actual substance that the person is using. In children, what happens is if the person is born to an addicted mother, the child usually has a certain sensitivity to the drug or can actually be born addicted to the drug itself. So what we see from a medical and biological perspective are basic developmental and cognitive deficits, definite respiratory complications because the drug methadone acts on the central nervous system and respiration, cardiac irregularities, and liver and metabolic trouble. The other area that I like to look at that affects children long term as far as addictions is psychological development. And really, there's a lot of developmental delays, and there can be cognitive, attention deficits, memory deficits. But the psychological effect that usually is most damaging is that the person that the caregiver or the mother or the father, if they are addicted also, is going to be less likely to be a nurturing parent or actually a really good caregiver. So what you start to see is, in addition to the biological or the medical problems, that these kids are not really being parented correctly, so they lack a lot of social skills and a lot of love and support and compassion from their parents. And with that goes to the third area of long-term effects, which is psychosocial. And psychosocial, what we mean is most kids with addiction problems or that are born into families with addiction problems tend to come from lower socioeconomic status. And not all the time, some can come from upper socioeconomic status, but most of the time we see them in lower socioeconomic status. So they're challenged already, but then there's lack of social support. They have lack of peer support because a lot of their friends aren't from the same type of families with addictions or whatever. And also we see that there's a lack of self-acceptance or self-esteem in kids with addictions because they know, by the behavior in their family compared to other families, that there's some major differences. My name's John Bosworth, and I'm talking a little bit about the long-term effects of methadone addiction in children.